So there's the question everyone asks about a BBL, and then there's the one that they should. Almost everyone who sits down with me about a BBL opens with the same question: how big can you go? And I get it. But that's not the first question that decides whether you love your result or whether you're safe. So today I'm flipping the order and telling you what actually matters in plain English. What a BBL really is. The one safety detail you should grill any surgeon about, whether you're even a candidate, and the recovery, which has rules that are not optional. No scare tactics, no sugarcoating. I'm Dr. Sadio, board-eligible plastic surgeon at New Me Plastic Surgery here in North Miami Beach. BBLs and body contouring are a big part of what I do. Let's get into it. What is a BBL actually? It's not a lift. So first, let's fix the name because it's kind of misleading. BBL, Brazilian butt lift, is not a lift like, say, a breast lift. Nothing's being hoisted. There's no implant. So if that's the picture in your head, I want you to delete that. Here's what it actually is: a fat transfer. So step one, I use liposuction to take from places where you'd happily give it up, belly flanks, back. That's the step that snatches your waist. Step two, that fat gets purified and carefully placed to add shape to the buttocks. It's your own fat, but it's moved from where you don't want it to where you do. So a BBL reshapes two areas at once: a smaller waist, fuller curve, and that contrast is the whole point. And because it's your own tissue, there's no foreign implant, no foreign material. But your result leans very much on how much fat you have to work with, which is exactly why the evaluation matters so much. Is a BBL safe? Here's the one thing to ask every surgeon. Now, the part I care about the most, and I'm not going to dance around it, you've heard that BBLs can be risky, and there's a history there. There's a reason why everyone says that BBLs are risky. You have to protect yourself. So the serious risk historically came from the place where that fat was being placed. If you place it too deep into the muscle or below the muscle, it can reach very large blood vessels in that area. The entire safety shift came in this field when we changed that principle. All of the fat, and I mean all of it, goes above the muscle in the layer just under the skin. Never into it, never under the muscle. So some surgeons will use ultrasound guidance, that's what we do here, to confirm exactly where we are exactly the entire time. I can also feel where I am. So it's feel, it's knowing where you are under the skin, and also using the ultrasound. So here is your homework. And it works at any practice, including this one, including mine. Ask where the fat is placed, above the muscle or below. Ask where the surgery happens, whether that facility is accredited. Ask who's doing the monitoring, who's doing your anesthesia. A surgeon who's glad you asked those questions is a green flag. I love educated patients. I love my patients who ask those questions. Anyone who gets cagey about it, keep shopping. And here's a blunt word on price. I have to say it. This is not the procedure to go cheap on. It's not the one to look for the cheap quote. When an offer is dramatically lower than everyone else's, there's going to be a reason for that. That gap comes from somewhere. Is it the setting? Is it the monitoring? Is it the time they take? Is it the credentials of the people who work there? Those are the exact corners you just do not want to cut. Trust me. Am I a candidate for a BBL? Here's the big surprise, the big fat surprise. And it's a plot twist. It catches people off guard. A BBL runs on fat, so you need enough of it to move. If you're very lean, you may not have the volume to get the result that you're picturing. And no honest surgeon can invent fat that you don't have. So sometimes the real answer is, let's time this differently. Or maybe we need to adjust your goal. And that's not a no. It's just me being very straight with you and getting you to your goal. 2 more things I'm checking. Are you at a stable weight? Because transferred fat behaves just like the rest of your body's fat. It shifts if your weight swings. Are you a non-smoker? Or are you willing to quit around surgery? Very important. Smoking hurts how well that fat survives. The nicotine kills the fat. Honestly, are you ready for the recovery? A BBL asks something very specific of you afterwards. It's not the same as other surgery. If the timing's wrong for you, I'd rather just say no now than have you white knuckle it later. What is BBL recovery really like? The no sitting rule. I get asked about this a lot. Recovery is where a BBL is genuinely different from most procedures, so let's lean in for this part. The headline. The rule is no pressure. That newly transferred fat needs a blood supply to survive, and sitting or lying directly on it squeezes those delicate, fresh new cells. So in those early weeks, you don't sit directly on your buttocks or on the hips if you've had fat transfer there. Most people use a cushion. It's called, the BBL pillow. Everyone talks about that. And that will shift weight to your thighs. And also, you must sleep on your stomach or side. So in that first week, you're sore in 2 places. Where the fat came from, and then where it went in. Plus swelling, bruising, and you will need to wear your compression garment on those liposuction areas. Very important to train the skin so it will snap back. You're resting, but you're also taking gentle walks. Okay, weeks 2 and 3. It eases. A lot of people head back to a desk job. Around here, you're wearing a cushion. You gotta have your cushion with you. Weeks 4 to 6. We start easing that sitting rule in stages based on how you're healing, but not all at once. And that shape, it's going to keep refining for months as the swelling leaves. So don't judge your result early. I mean that. These are typical timelines. They're not promises. Your body will set the pace and we will adjust with it. Those are just working guidelines, but you really do need to just trust the process. How do you keep your BBL results? People ask me constantly how to keep the result. And it really comes down to 2 windows. Early on, protect the fat. Honor the pressure rules. Wear your compression garment. Hydrate. Eat enough protein. Don't rush back into things that stress those areas. A portion of the transferred fat naturally doesn't survive. And that's expected. I planned for that. But good aftercare gives the rest of that fat its best shot. Long term, it's one word: weight. These are living fat cells, so big weight swings will change your result in either direction. Steady weight is how you can keep that shape that you work so hard for, and that we've all worked so hard for, and that you've paid for. Finally, show up to your follow-ups. That's how we will catch those small things early. Stay in touch with us. BBL red flags. When should you call? Quick, very important. I want you to know the normal from the call now. That's a very important part of a safe recovery. Here's what's normal early on: swelling, bruising, soreness, firmness, drainage from the liposuction sites. These are all expected, and we expect to see all these things in all cases. But call us promptly for fever, spreading redness or warmth, pain that's getting worse instead of getting better, drainage that suddenly changes or smells off, or one side swelling a lot more than the other. Anything with your breathing, shortness of breath, chest discomfort. That is a 911 situation, not a wait and see. None of this is to scare you. I just want you to be educated so you're not sitting at home guessing, wondering what's normal and what's not. So at Numi Plastic Surgery, you can reach us at 305-330-3004. And I'd always rather that you call, even if it's something small. How to start? Your free consultation. So if a BBL is on your mind, do not start with a price or a photo that you've saved somewhere on your phone. Start with a real conversation. I want you to talk to me. When we sit down, I will look at your body, look at your fat. I tell you whether the result you want is realistic with what we have to work with. And I walk you through exactly how I'm going to keep it all safe for you and get you the result that you want. You're going to leave with honest answers either way. Everyone knows I don't sugarcoat it. I really tell you the truth. So that consultation is free here at New Me Plastic Surgery. And you can give us a call, the same number, 305-330-3004. You can also head to the BBL page on the website to learn more and reach out. No pressure, just the truth. So you can make the smart call.